through IOSH and the work that you've been doing on a European level. And we're really excited to hear more about the new ISO that is coming our way, which I think will be a changing landscape for many organisations as well, to sit alongside the HSE management standards. So I will hand over to Ivan. I will share his slides and look forward to hearing more.
Thank you. Thanks, John, Rachel, for the invitation. And as you were saying, I must confess, I really miss face-to-face events. My name is Ivan Williams Jimenez. I'm Policy Development Manager at the Institution of Occupational Safety and Health. And this presentation comes as part of the work carried out in the ISO 45003 long title, Occupational Safety and Health Management, Psychological Health and Safety at Work, Managing Psychosocial Risk Guidelines. We've been discussing a lot about the title, to be honest. Next slide, please. We know that demonstrating a commitment to the management of psychosocial risk is becoming central to positioning safety, health, and well-being of people at the center of the business agenda, as we've also seen on other presentations. And these are some of the figures that help to build on this momentum. Some of those figures are global or international, other have like a European context, and there are also like some national figures that you might be already aware of. And I found particularly interesting the one from the European Health and Safety Agency, SNR3 survey, that highlighted that when it comes to psychosocial risk factors in the workplace, it's almost a quarter of the surveyed establishments that report having none of them considered, which is quite concerning. Next slide, please. And because of my role is much focused on regulation, policy development, I found this chart really interesting. And this is from Professor Stavroula Leka and Professor Aditya Jain, and they are both part of the current working group of the ISO 45003. And this is basically their framework, sustainable development using an integrated health and safety and well-being approach, where we can see how in the top side, occupational safety and health management systems play a key role. And we believe this is a holistic approach when tackling like mental health and well-being in the workplace. And it makes business sense because it tackles other areas of the business like sustainable development goals, corporate social responsibility, business human rights, health and safety, and human capital management or HR management. And I think it's fair to say that more recently at a European level, the Council of the European Union has produced a paper called Enhancing Wellbeing at Work. And basically, they are telling national states that the perspective of well-being at work needs to be like horizontally introduced in national and union policies. And whether you believe it or not, this is quite innovative. I'm pretty sure a previous colleague from HSE will probably agree with this. Next slide, please. Thanks, Joe. And when it comes to the work that has already been done through management systems, this table helps to provide an overarching picture of global, regional, and national norms created to make employers and workers engage in psychosocial risk management. Needless to say that most of them are voluntary approaches in the form of standards, guidance, or tools. And prior to the meeting, I had a chance to see Joe's video, and she was referring to some of these norms, such as the PRIMA EF guidance on European Framework for Psychosocial Risk Management. Also, the British Standard Institution PASS 1010 guidance on the management of psychosocial risk in the workplace. And we also have a recent code of practice, PAS 3002, on improving health and well-being within an organization. But it's true to say that, unfortunately, many of these standards or norms have faced a similar challenge. And this is that, they have had limited uptake from businesses and professionals. Thank you. Until ISO 45000, existing international standards for OSH somehow lacked of clarity around the concepts of psychosocial risk in their management. This is something that we might be talking afterwards during the Q&A session. But it's true that ISO 45000 draws the attention to psychosocial risk management, and mental health aspects in the workplace. But when going through the standard in detail, there was clearly a need for something else. And it's true that, the current standard says that an organization is responsible for promoting and protecting the physical and mental health, and we've seen this also in other regulations or legislative frameworks. But this is the first time that, mental health and well-being will be properly referred. And as part of the work done for the ISO 45000 on occupational safety and health, there's been created a working group on the ISO 45003, and this new psychosocial risk standard would be intended to provide systematic guidelines for employers and workers that will enable them to promote and develop and improve what is called a psychologically safe and healthy work environment for the workforce. And I think it's quite interesting to say, because there's been lots of debates in the working group around this issue, that throughout the standard there's a range of terms that are used in relation to what psychosocial risk affect, including psychological health and mental health. And we need to be conscious that the current, the future guidelines have a strong international aspect. So while it's true that in the UK or other European countries, could be used to some kind of terminology, such as management of psychosocial risk or mental health and well-being, we also need to be conscious that other approaches from Canada, Australia tend to talk about psychological health and safety. This is basically the timeline of the project where we are at working group. So the standard is currently going through public consultation, and you might be already aware of this, or you might have already seen this through social media posts or websites, through national standard bodies. And basically, the close of comments will be on the 4th of October. The final text after that will be registered for formal approval on February 2021, and the international standard is meant to be published by June 2021. So really not long to go. These are just examples of the current consultation that is going on. The first one is from IOSH, and the other one is from British Standard Institution. So basically, if you want to comment on the current guidelines, if you are an IOSH member, you can do it. I think it's till the 18th of September, and if not, you can approach your national standards body. As far as I know, it's a British Standard Institution, and you will be able to do it till October, till the 4th of October. Thanks, you. And when I was referring to the working group that has already been involved in this, or is being involved in this task, we can say that we're talking about 136 participating experts, with an average of 50 to 55 participants per session. Of course, in the beginning, it used to be face-to-face sessions, and as part of the COVID-19 situation, we've been held in virtual sessions. from more than 45, more than 40 participating countries from all over the world, and also 6 international liaison organizations such as IOSH. And I think this global aspect is quite interesting to be considered, because we need to understand that, well, UK or many countries in Europe are at a certain level of maturity when it comes to dealing with this risk. But then there are also other, like emerging economies, emerging countries, or developing countries that this topic is quite niche. And one of the benefits of the guidelines are based on the credibility, as I was saying, of the global standard. And well, these are the main clauses that might be of interest to professionals and practitioners. The context of the organization, leadership and worker participation is probably, in my opinion, the most interesting one, because the current guidelines make a strong effort on the participation of workers in all stages of the process, and how critical to the success of managing psychosocial risks there are. They also put a strong importance of raising awareness of psychosocial risk, developing competence, which historically has been one of the main lacks when it comes to managing psychosocial risk, and also supporting the recovery and return to work of affected workers. And it also puts the current state of the guidelines put a strong emphasis on the need for an integrated policy and recommendations to identify psychosocial hazards, and this could come as part of different activities such as analyzing work tasks, schedules, locations, carrying out work inspections and observations. As Joe was saying, of course, risk management will be key within this process, and then reviewing relevant documentation such as incident reports, hazard and risk reports, occupational health statistics, or worker compensation claims, absenteeism, turnover data, and so on. And I thought this would be like really interesting. This is the work that IOSH, my institution, has been doing for the last few years. So in this particular topic or area, so we've been commissioning research. As Joe was saying, I used to belong to the research department, so I still have that research, let's say, expertise. So we've in the past we've funded research on return to work on workers on sick leave with common mental disorders, with a specific focus on different sectors, such as the seafarers sector. We also commissioned a really interesting survey on unacceptable behavior on health and well-being at work, or the Irish Workplace Behavior Study. And as the previous speaker was referring, we also work together with Nottingham University in the mental health state in workplace study, one of the first studies that measure the effectiveness of this training initiative. And below are just other resources that are currently on our website, such as the Occupational Health Toolkit, webinars that we've been delivering on the topic. We have a microsite on psychosocial risk, training activities or training products such as the Managing Occupational Health and Wellbeing course. And together with, more recently, together with management, we published a workplace wellbeing report, the role of line managers in promoting positive mental health. Sorry, can you go to the previous slide, Joe? Thank you. I just wanted to show here some other examples from other organizations. As I was saying, there's a strong global momentum on this topic. So these are just reports from either like international organizations such as the International Labour Organization that recently commissioned the managing work-related health and work-related psychosocial risk during the COVID-19 pandemic, but also from private consultancies such as Deloitte or Ernst & Young from studies in the UK, well, in Australia, and also in Canada. That was a particularly interesting one, measuring the return on investment on workplace initiatives when it comes to tackling or managing these risks. And well, as I was saying, the final form of the guidelines will take shape approximately by June 2021. But well, I think that in the meantime, I think this is a strong message to be sending out there that organizations still need to focus on the work environment design as a priority and to incorporate this risk into corporate risk management and business operations. Systems and structures for that purpose will be really important. And psychosocial risk management cannot be approached solely, and that's the reason why I believe these future guidelines will be really interesting for different target audiences. So not only like health and safety professionals, human resources professionals, but also like occupational health practitioners, consultancies, employee assistance programs, and so on. And finally, by the end of this month, on the 30th of September, some of the members of the current working group will be delivering a webinar with the same title, The Changing Landscape for Managing Psychosocial Risk, with different like national perspectives from Australia, Malaysia, and Canada, and also with an overarching picture from at a policy level. So that's the hyperlink if you want to join, and we'll probably see some social media posts going on as part of the webinar. And Joe and rest of participants, I think that's all from me. I'm happy to take any questions after